back to Dr. Paul's Advanced Skin and Hair Solutions. We have Dr. Sanjay today with us, and we will be talking about hair transplant today. Welcome Dr. Sanjay. Thank you for giving us time.
Welcome. What is hair transplant? We already know. What is the procedure we follow? So in Dr. Paul's, we usually follow FUE, that is follicular unit extraction. In this process, we usually pluck up the single hair follicles with the help of micromotor from the donor area. Before that, we give proper anesthesia in that region so that no pain occurs. In FUE, we create minimized trauma to the donor area so that post-operative phases we experience less pain and less hassles.
Can you tell me what is the pain thing? Like people think that hair transplant is a very painful process or something like that.
First, you have to understand that it is a minor surgical procedure where we create, especially in FUE, very small trauma by our specialized machineries, so that after the surgery, recovery rate is very fast, and our post-operative advice also being carried out to the patient so that patient feel maximum relaxation. In this procedure, we usually give a very small amount of anesthesia.
Okay, it's a topical thing. It is not general anesthesia kind of thing, no?
Hair transplant procedure we usually follow local anesthesia as it is a small surgical procedure. As Dr. Paul has produced a small device that produces very less invasive trauma during the anesthetic procedure.
Is it a common thing, or only Dr. Paul's is providing this kind of pain-free things?
See, the pain occurs only during anesthesia, maybe. But Dr. Paul's has introduced a specialized pain kind of thing for the anesthetic administration, where we produce very less trauma during anesthesia, as it is a very selective procedure, and in this way we minimize the pain while giving anesthesia. And after anesthesia is done, there is a complete numbness in the area and patient experience no pain at all. After anesthesia, the procedure runs for about 6 to 8 hours. In between procedure, there is no pain at all, and in between patient may go to washroom also, and may patient have a proper lunch break there. So it doesn't create any that much fear, and after the procedure also there is very less pain.
This sounds wonderful actually. What are the side effects can somebody expect from a hair transplant? Because there is lot of things floating. Everybody says that transplant has got side effects, adverse effects. Is there anything really?
See, during hair transplant procedure, as we have mentioned already, we take the hair from own body. As we are taking our own body hair, so there is no chances of contamination, and also no chance of the same blood, same graft, same skin, same hair is scooped out from a donor area and it being implanted in the recipient area, where there is a minimum chance of infection, and as we also provide very sterile environment there, maintaining all the protocols, so there is very less chances of contamination, cross infection and all. And in this way, side effects, there is very less side effects. There are to say no side effects in this procedure.
So that was really relieving that hair transplant has got no side effects. This point should be noted. From the area where you are taking all these grafts, does this regrow again?
See, the hair is being taken out from the proper donor area. So once we scooped out the hair along with roots and implant in the proper recipient area, so in that donor area it remains unfilled. So
it will never regrow again.
No, it will not remove. As we are transplanting the thing from one side, as we are migrating the hair follicles from the donor area to the recipient area. So there is no chance of growing of hair from there.
Okay, in that case, these bald patches will show?
For that reason, in recently we are doing all this FUE technique. So in FUE, where we take out the hair from the multiple locations, not in a proper linear fashion or in a proper way of pattern. We usually take the hair follicles from multiple locations, and for this reason, after the post-operative procedures, the adjacent area of those donor site is being filled up with other hair follicles. So you can see that there is no patches, no gaps. All the area looks like as it is normal as before.
Okay, so these hair roots will not grow again, but there would be no visibility of bald patches post hair transplant. Am I right?
Right.
Now the next question which is popping up in my mind is why there is a long list of pathological tests before hair transplant?
Okay, for selection of a proper case for a proper patient for a hair transplant, this is a surgical procedure. So we need to know all the parameters patients having. In that region we can manage patient prior with medicines and other steps like that. And if we know if a patient suffering from any kind of pathological condition, we can pre-guide the patient and make him to his normal limits, and we can do the procedure successfully. Diabetic patient is there is a type 1 and type 2 diabetic patient. So for type 1 we can manage, is a controlled diabetic patient. So we can manage the patient by making lab test, blood test. So if it's in a controlled limit, we can do. For type 2 diabetic cases also, if a patient is in a controlled diabetic state, so we can do the cases, no problem with that.
Okay, so now we know that even diabetics can go for hair transplant. They can have also their hair transplanted.